Okay.
Hi, Dr. Greg Mendel, your friendly anatomy professor. We're going to go over the muscles of the head and neck. So come on in, let's take a look. So when we're looking at this model, there's a couple things to get out of the way first. First of all, we see in the front here we have the pecs, right? So we have the pec major, which has the clavicular and the sternal division. If we pull that out of the way, somebody labeled this but forgot to remove the tape, that is the pec minor. Now the pec minor, as we can see, does not attach to the clavicle. Clavicle is cut away, but it would normally be sitting here. We have the deltoid muscle. The deltoid has 3 heads. We have the anterior deltoid, which attaches to the lateral anterior 1/3 of the clavicle. The medial deltoid, which attaches to the acromion process, and the posterior deltoid here, which will attach to the spine of the scapula. If we move around towards the back, we can see the trapezius muscle. If you look, the trapezius muscle goes all the way up to the occiput, down the T7, and over here on the acromion and the spine of the scapula. It's trapezoid shaped, trapezius muscle. If we look here, we see that the scapula lies here. I'm going to tilt this so you can see it. We see a muscle coming off of the scapula going up. If this muscle were to contract, it takes the scapula and pulls it up. Therefore, to bring it up, levitate, or levator scapula. So levator scapula. The rhomboids we see attaching to the medial aspect of the scapula and to the spinous processes of the upper thoracics. And you'll see that there's one muscle here, there's a dividing mark right about where that stick is. This is the rhomboid minor, whereas down here we have the rhomboid major. They allow medial retraction here of the scapula. So like if you put your scapula together, that would be there. If we work our way around to the front again, we see here is a very thin muscle called the platysma. The platysma is very thin. It's like, I don't know, thickness of several sheets of cardstock paper, and you can see that that's covering the very outer surface, and there's skin over the top of that. We have a muscle right here which starts at the manubrium and the medial aspect of the clavicle. And so we see it going up and attaches at the mastoid process. This is the sternocleidomastoid mastoid. So SCM, sternocleidomastoid muscle here. If we look at the face, there's a few things we're going to look at. First of all, we could see that there's a muscle that is on the lateral side of the jaw here. It goes up and attaches to the mandible and causes it to be elevated. And so one of the muscles of mastication, the masseter muscle. Here we're going to see this muscle going across. It's a little bit in the cheek, if you would, and that muscle kind of, you can cause your cheek to kind of push out and such. Like if you contract this muscle, you kind of pull your lip back, and so that is the buccinator muscle. Here we see muscle here and here, and so these are the zygomaticus major and minor. On our test, zygomaticus is basically what we're looking for. We see there's a muscle that goes all the way around the mouth, and so that is, around means orbicularis, and so orbicularis, this is the mouth, which is oris, so orbicularis oris. We have another muscle that goes all the way around the eye, orbicularis oculi. We do have a muscle up here on the frontal part. It wraps around to the occipital. It's the occipitofrontalis. There's a frontal belly and an occipital belly. If we go around to over here, we can see a little bit of that masseter remaining, but we also have the temporalis muscle. I believe that that is just about it, but I have 2 more things to mention while we can see them on this one. Intercostals. We have an internal and external intercostal. The internal intercostal is best seen on the inside, of course, but it could be seen here, and then we have another layer on top, the external intercostal. I believe that's it for this model.